Hello, and welcome once again to On the Go with the Glenn Advantage team. I'm your host, Marcia Glenn, and today I'm especially thrilled about being here at Trillium Health at the Monroe Square facility, and we are talking with President and CEO Jason Barnecut-Kearns. And thanks for spending time with us today. Tell us a little bit about yourself, because I've read through, and I hope you don't mind if I kind of read through your mission and your vision statement,
Yeah.
and then maybe you can expound a little bit on that. That would be great. So, their mission statement for Trillium Health provides compassionate, judgment-free, and affordable healthcare to everyone. And the vision, with deep roots in the LGBTQ plus community, we are dedicated to reducing health disparities by providing access to high quality healthcare to everyone in the greater Rochester area. And with that, I'll turn it over to you, Jason, to kind of expound, introduce yourself, and give us a little bit of background, if you wouldn't
Yeah, of
mind.
course. So first of all, welcome to Trillium. We always
Thank you.
love to invite guests over to Trillium and get to know us a little bit more and see some of the work we do. So as you said, we're a community health center. So we're in our community in the city of Rochester, really focused on providing that affordable healthcare to everyone. So it doesn't matter if you can afford healthcare, if you have insurance, if you don't have insurance, we welcome everyone. That's what it's about. So, and it's also about finding ways to eliminate those barriers. So, we've got other wraparound services that provide care to our patients and clients. So, you might be experiencing food insecurities, for example, which is a great one I always use. And that could be, okay, I need access to food. So, we have our food pantry. We welcome people into our food pantry and we'll provide you with the support at that moment in time. But we also then start to make a connection with you to understand, where are you getting your primary care? Do you even have primary care? And if not, let's get you connected into primary care. And that's what we do here, is we get you into the medical care that you deserve. Doesn't matter which part of the community you're from, we welcome you, and we will get you registered with one of our providers. And with that, then you get on your journey to provide that healthcare that you deserve in a judgment-free manner as well. I think that's really important. The team here at Trillium looks like a part of the community that we serve. So that's what we want to make sure, that you walk through our doors, you're welcomed, and we appreciate where you come from. So we're meeting you where you're at that point in time, get you connected to care, then get you connected to all those other services after that as well. So it could be making sure we fill your prescription in our pharmacy. We have 3 pharmacies on within our locations, and that's critical. That we want to make sure that you walk out of the door with the meds that you need and you've received that care from our providers.
That's great. So, love the mission and love the vision. What's a little bit of background on yourself, Jason? And where do you come from, and how did all of this get started?
Yeah, so I think my background's a little unusual for healthcare because I actually started in the corporate world. So you can tell from the accent, I'm not a local Rochesterian.
No.
I'm from the UK. So I worked for Xerox Corporation in the UK just over 23 years ago. I came over for a 2-year assignment to work on some projects, and I ended up staying here forever. And with that, as I got connected with the LGBTQ plus community, which I'm part of, I found out more about Trillium Health, or the former organizations. It was pre-Trillium Health. It was when we were AIDS Rochester, and started to get connected as a volunteer, supporting the organization in terms of providing care boxes during this holiday season to patients living with HIV. So that's how I got to know Trillium. After a few years of being involved in that capacity, I eventually became a member of the board of directors. So in 2018, the CFO role opened up here at Trillium Health. I'm a finance guy by trade, and the CEO at the time, Andrea DeMeo, asked me if I would be interested in joining the organization, and I did. And that was the start of my Trillium journey. I became CFO, started to oversee all of our fundraising efforts, oversaw a lot of our non-clinical services. And then when Andrea DeMeo made the decision to retire from the organization, I applied for the job as CEO, and I was honored to be appointed CEO in 2018.
Wow. So the
That's not
community,
2018, sorry, 2023.
okay. Well, the community is very lucky to have had you join and decide to stay with us, obviously, just based on that background and coming into play with Trillium Health. So I think all of that is a fabulous background to be working with. So a couple of things. The names of many healthcare providers are derived either from the parent company or a reference to health or strength. United, CVS, Johnson & Johnson, Pfizer, Cardinal. Trillium is the name of a wildflower. So tell us more about that. How did that come?
So I think, yeah, the Trillium flower. So that's the formation of our logo. The three petals really represents three elements of the care that we provide. It's that social, emotional, and physical elements of providing care. Actually, from looking at your research, I didn't actually realize that they went back to our founding values because I wasn't so involved in the early days of being courage, hope, and innovation. And we're actually going through one major change in the organization. One of our co-founders, Dr. Valenti, is stepping down at the end of this month. And he has been with us right from the start. He co-founded Community Health Network, which is one of was the clinical arm of what Trillium is today. And so I think when I look back of how the organization has evolved and what we started as a HIV organization providing care to individuals that were diagnosed with HIV in the 80s. And then our other organization, or AIDS Rochester, which was focused on the supportive services, so those wraparound services. When I look at where we are today, that's what we still do. It's all around providing that one-stop shop for everybody that walks through the doors. And we provide care in that judgment-free, compassionate way as well. And of course, we want to make sure that anybody walks through the door can get it for free if they can't afford it, or we can help them navigate through those processes to access insurance, other forms of funding to provide their care. So it's interesting that looking at that courage, hope, and innovation, we still do it. And I think in today's environment, that courage and hope is so critical today as well as we face some of those challenges ahead of us.
I have to agree with you. Totally. Today's world is in need of the courage and the hope and looking forward. So what are some of the other points that kind of make Trillium Health unique?
So I think, some of the other points is, first of all, our staff. I really think that makes us a lot different to the major health systems, other community health systems, is our staff are so aligned to the mission. And as I said earlier, they're part of the community as well. So that is really important. They have individuals that have life experiences. They've experienced homelessness. They've previously been incarcerated. They've experienced food insecurities, and staff today are also experiencing that as some of the challenges we're all seeing of the cost of food. So I think that's what makes us different, is that when a patient client walks through the doors, that they can see somebody they can actually relate to, and then that helps kind of eliminate some of those barriers of going into maybe a new provider. But also, I think the other thing is we have friends and family as well. We are really fortunate that our board of directors is made up of our patients as well. 67% of our board are patients of our services as well.
Wow.
So I'm accountable to my board of directors, and they see what we do every day through their lens of coming in through our clinics as well. So that makes us a little different to other nonprofit organizations. Is we react to the voice of our patient as well.
So many things not known in regards to Trillium Health.
Exactly.
So in early 2025, Trillium became a federally qualified health center, increasing its access to federal resources and allowing it to serve more people. What are all of the different kinds of services? We kind of touched a little bit, but the kind of long list of all those services that you do indeed offer, which is outstanding.
Yeah, no, there's a whole raft of services. I think the main one is we provide that primary care. That's our main service line. But alongside that, over the last number of years since 2018, we've really been on a growth strategy. So we've expanded into pediatrics. So over at our other location at Science Parkway, we have an amazing, welcoming pediatrics practice as well. We have a GYM practice over at Science Parkway as well. So again, in a very welcoming environment. We here at all of our locations, in some of our satellite locations, we do sexual health as well, and that's all around be available to do testing for HIV, for STIs, other Hep C testing. That's really important from addressing public health issues, and then of course helps us then link individuals that get tested as positive into the care that they need to do to then to mitigate Hep C or live with HIV. We've got amazing medications that now allow you to live normal lives through the medications if you've got HIV, or if you're thinking about going on to medication to prevent you from getting HIV, we can go on to PrEP as well. So that's a really big thing, and that's really continued through our legacy of our organization. We also have a harm reduction location over on Delavan Street. So this is a place for individuals that might be actively using drugs, but they have access to services like basic needs of just some basic food. Many people are still living on the streets. They can get access to clean needles as well. So important. And then, of course, get access to testing. When they're ready, we can then go into programs to support them to go into treatment for substance use disorder as well. And then one thing that's really we've seen growing over the past few years is the need for behavioral health. Mental health is so important. We've really expanded access to behavioral health here at Monroe Avenue. We now have mental health providers at Science Parkways to support our kids, and also at our Delavan Street as well, where we have harm reduction. We also then have our pharmacy as well. That's really important. Our pharmacy is critical to the financial sustainability of this organization. We participate in a 340B discount program, which means we are able to purchase medications at a discount, but we then invoice the health plans at market rates, and that additional profit or margin that we make goes back into our programs and services. It has to go back into our programs and services. So that's why we can really provide the high level of care that we do today, but also those wraparound services as well. And those wraparound services include things like our food pantry, transportation, helping people get connected to housing. We do have a small housing program for individuals living with HIV. So we will look for ways to either bridge some of those gaps or find partners in our community that can help address those gaps as well.
So, in terms of all the medical needs that are out there, this is kind of all in one place that people can feel secure in the fact that when they arrive, wherever they may fall can indeed be addressed. Kind of different than the rest of the medical field that's out there where you're walking into one office and you have no idea whether or not you're going to get taken care of properly,
Right.
if it's the correct care that you're looking for, and are you going to have to visit X number of other offices in order to complete that care process.
Yeah, that's the plan. That's what part of community health centers is all about. Is it's creating that one-stop shop for individuals, and as we look to grow as well, we know there's other areas that are of need as well. We know dental is a major challenge for many people in our community, getting access to dental providers. Today, we don't do dental, but we have relationships with other providers in the area that we can connect our patients to. My vision is to have a dental practice within Trillium Health as well, and access to vision services as well, just as critical. So, but you're right, having that one-shop place where you can just come to and access those services is so critical. I always say it's a little like Disney World. You walk out of the clinic, and of course, you go to the gift store. You go to our pharmacy. You walk out of the pharmacy with your medications on hand as well. the good thing that we've also done is we've adapted, because we know here in Rochester, things like pharmacy services, there's issues here in the city of Rochester. We're calling them pharmacy deserts. So we've seen the Walgreens just down the road from us, they've closed. Rite Aid have closed their branches here in the state as well, but in Rochester. So that's having an impact. So we've been really thinking about how do we fill that gap for our community. So we have other services that support our pharmacy, like our mail order or home delivery. So you don't necessarily have to come to Trillium to fill your prescription. We can get that prescription to you as well.
Well, seeking medical care, I know, can be an extremely daunting process, very overwhelmingly huge in people's lives in terms of concern. And it feels like, from what you're telling me, Trillium Health has tried to make it as nice and a good feeling process so that when you do come through the door, you don't have to be concerned.
Yeah, that's why our mission statement says judgment free, compassionate. Those two words are so critical, because you want to come through the door. You might be homeless. You might be using drugs. We don't want that stigma, judgment to occur when you walk through the door. That's what we started as a HIV organization. It was all about providing stigma-free care to a community in the 80s. That stigma was such a big thing. And that has been part of our DNA ever since. So I'm really proud that those two words are critical in our mission statement, and we do live it every single day.
Good, as you should be proud of that particular mission statement. So I understand you're opening a new location in 2026, and they have one location on wheels.
Yeah.
So tell me about those two.
Yeah, really excited. So as becoming an FQHC, one of the requirements is for us to grow. And with the funding that we now get through the federal government, is we want to make sure that we increase access to the community. Here on Monroe Avenue, we have 17 exam rooms. We're adding more exam rooms in 2026, but we know when we look at providing community health, sometimes you need to be also embedded in parts of the community, because in the city, access to transportation can be critical. So we found a location over on Jefferson Avenue in the city, which is going to house a brand new clinic. It was a previous private practice many years ago, which was scooped up by one of the systems here in Rochester. They closed the doors and moved that practice into one of their other locations. So we bought the building last year, and now it's going to be a clinic with 6 rooms, access to behavioral health, and a care manager as well. So, and it's embedded right in a neighborhood, right on a bus line as well. So really excited about that.
Exciting for sure. Yeah.
But then you did ask about our clinic on wheels. Yeah, we do have a mobile access clinic as well. So that literally is a 2-room clinic that is out and about in the community. It's out at our harm reduction site twice a week. It's in the parking lot there, because we can't provide medical services in that building. So individuals that come through the door there, they can go on to the mobile access clinic and access care. It's out in the community at places like the Father Tracy Center. So again, that's what it was designed to be. It's a clinic on wheels that can be anywhere in the community. Really critical. Was also really important during our previous time with COVID. We leveraged having a mobile clinic to be able to go out into the community, help with testing, but also at the same time help with then doing vaccinations. So that's what we do well, is we respond to community need, and that's what our federal government wants us to do in terms of community health, is look for underserved populations, medically underserved populations, and bring care to support those populations.
All of it very forward thinking.
Always. That's what we're always
No.
good at.
So the roots and heart are deeply embedded in the Rochester community. While it has always been an extraordinary healthcare agency, it wasn't always Trillium, which you kind of touched a little bit on during part of our conversation so far. If you could maybe expand a little bit more on that.
Yeah, so as I said, we started in the 80s. So we were formed out of 2 organizations, AIDS Rochester, which started in 1983 as providing those supportive services to individuals that were diagnosed with HIV, support for the individuals, but also the families that were dealing with that crisis. And then in 1989, Dr. Scheibel and Dr. Valenti, our co-founders, co-founded Community Health Network, which was really the foundation of our clinical arm of Trillium Health as it is today. And then in 2010, the two organizations came together and became AIDS Care. And that really then started the next part of our growth, expanding services a little beyond HIV care to serving our LGBTQ plus community. And that's why our vision recognizes where we came from in terms of those deep roots of being trusted care providers to our LGBTQ plus community, because we know many individuals who are living with HIV are part of our LGBTQ plus community. Then in 2013, as we started to expand even further, AIDS Care was really limiting in terms of the name for the organization and representing what we do. So we rebranded to Trillium, and that was the journey of where we then moved forward to using the name, the brand, and building that name within the community. So now when people think of Trillium Health, we are that community health center that provides care to our LGBTQ plus community, and now we serve everyone in the community.
Never losing the vision,
No,
just expanding.
exactly. Always the opportunity to grow.
So one of the most extraordinary things about Trillium Health is the intentional way it strives to simplify people's lives. And again, we've touched a little bit on a few of those things that the clinic actually does, Trillium Health actually does. It's purposely constructed so that someone can see their doctor, go to the pharmacy, get their lab work done. If they are food insecure, go to the food pantry and go grocery shopping all under one roof. All of that is pretty amazing. So we touched a little bit. Maybe you can expound on each one of those, such as what is a food pharmacy and talking about the food pantry and your grocery shopping model. How does that all come into play?
Yeah, so I think the food pantry, we've always had a food cupboard. It was something that we've had for many years, and it literally was a cupboard where we had bags of food that we would give out to individuals. During COVID, we really saw food insecurities grow. So in response to seeing that need grow, we created a food pantry, and we had some space in the building that was not being used for programs anymore. So we actually started to build out what we called was our food pantry model. And the team came up with a model. We didn't want to be the regular food pantry where we just gave a box or a bag of food. We wanted to allow people to come through the doors and be treated with dignity and respect and be able to shop like it is a regular store. So that's what we designed. We created this food pantry, and then thanks to funding through the county, through the America Rescue Plan funding, we were able to take that funding and make this a permanent fixture. So we were able to buy new fridge freezers. We have a massive walk-in freezer, new shelving. But now when you walk through, I say it's like walking through a Whole Foods store. People have a cart. They can then select the items they need, so there's no waste. People can then select the items appropriate to their family, and then depending on your household size, we can kind of then make sure you've got enough to take home to support your household. And so even as I look at what happened during COVID and that need increase, we've seen that accelerate over the last 12 months. When I look at where we were a year ago, we were serving around 600 households through our food pantry. Last month, we served nearly 1,400 households in 1 month, which again speaks to what's going on in the community. We've seen increased cost of food. We've seen some of the challenges with the SNAP benefits we saw last month as well. And people know that Trillium is there to support the community. And that's why we made sure we created this food pantry that allows people to walk in a dignified way, go shopping, and be able to then take food home to their families, which is so critical. At the same time as we started to think about food pantry, the team came up with a concept of food pharmacy, and I'm like, oh, food pharmacy, what is that? But it was a partnership that we came with, and it's about connecting with an organization called Headwater Food Hub, who provide fresh produce. Then with the Equicenter over in Mendon, where they have the ability to have a teaching kitchen, and then through funding that we had through the city and our patients, we came together and created this food pharmacy program where individuals that are experiencing high cholesterol, diabetes, can get enrolled into the program. They learn how to then cook with fresh produce. They cook the food in the teaching kitchen, and then they go home with a box of fresh produce, and then they can start to then change their eating habits as well. So that's really what the pharmacy piece is. Rather than medication, we're using fresh produce to change the way that you understand food and learn how to cook with it as well. And it's amazing. They learn how to use every part of the vegetable as well. So some of it's like with carrots, apparently you can use the head of the carrot and do something with it, and it doesn't go to waste. So amazing opportunity for our clients to learn how to improve the nutrition side of the ED.
And all of it being done with the dignity of the client kept in mind.
Exactly. That's what it's about. No judgment, but make sure that we give you the resources to help you learn.
Okay, so aware of how the closure of some of the nation's largest commercial pharmacies has complicated our lives, which again we kind of touched on a little bit. Trillium is working to ease that problem for the people of Rochester. So a little bit of background in terms of how that's working. I know you've kind of are realizing the pharmacies are closing and that there was a need to end up creating more access here.
Yeah.
And how is that put into place?
It really is, first of all, is having our own pharmacies allow us to create that retail experience. So just like you can go to CVS or Walgreens and go to a pharmacy, you can come to Trillium and you walk into a pharmacy like you do there and get your prescription filled. So that's we've been really focused on expanding access to pharmacy services. As well as filling your medication, you can come in and get vaccinations as well. So especially during COVID, our pharmacy team was out in the community providing vaccinations, and post-COVID, we continue to allow people to come in and they can get their COVID vaccinations too. You can come in and get your flu vaccination. But also we've been addressing the other needs around, well, you might not be able to physically get to Trillium Health to fill your prescription, as I said earlier. It's now we can mail order your prescriptions. We can do a home delivery as well. So I think that's what it was about, is ensuring that our community, first of all, knew the Trillium has pharmacy services, and then making sure that they can then get connected and eliminate some of those barriers.
Wow. So multiple remarkable things about the company that grew into Trillium Health began as an answer to a specific community, obviously, need during a time when people were at a loss. In the 80s, when the HIV virus was spreading, people were scared. There were too many questions and too few answers. Doctors like Dr. Scheibel and Dr. Valente helped to provide medical care and answers to those patients, some of whose own families had turned against them, which is just heartbreaking to even speak the words. As knowledge was gained and years went by, Trillium Health expanded its outreach to include anyone in need of care without fear or favor. Just like it did during the 1980s, Trillium stepped up once again during the COVID, which you had just spoken to help the community. And besides just being able to get their COVID vaccines and the flu vaccines, was there anything else in terms of expanding upon during the pandemic when everyone was sheltering in place and we had a whole community who wasn't actually able to shelter in place necessarily?
Yeah, I think during COVID, again, it was around getting tested and getting the vaccinations, but it wasn't just for our patients and clients. We were working with other partners in the communities. We had other organizations, other community-based organizations that serve the needs of the community for different services, like nursing homes or even the RPO, we started to have partnerships to say, okay, we will come in and we will test your teams so they can come to work and continue to provide the services. And as the vaccination came along, then of course, then we made sure that their team members could get access to the vaccination. So it was amazing that we became a hub. We quickly adapted as well because we wanted to make sure we kept the doors open every single day. And that's what I'm really proud about the organization. Though we kept the doors open, we found ways to still provide care. We had the distancing, but we would leverage some of the telehealth services as well, so people could still stay at home and get care through telehealth as well. But we just wanted to make sure that we could do what we needed for the community. We transformed part of our office into a testing area. So it was accessible to the street. So we put up a wall and we made that our testing area. And we redeployed staff members that couldn't do some of their programmatic jobs to support our clinical and our testing teams to help people get through testing. And then we were out in the community doing those testing events as well. And then as the vaccine came along, we were there with our mobile access clinic and our pharmacy team in the transit center in the city, where as people were coming through on the transit system, we could get people vaccinated. So we just responded to need. But also at the same time, we were educating the community about who we were as Trillium and understanding some of those barriers. So we started to understand what the challenges were to accessing primary care. And then we started, post-COVID, started to bring in some new programs, one that we call Project Access, which was around embedding our medical case managers at every single entry point into the organization. So if you came through then our food pantry, we had somebody who could then have a conversation with you about other things that were going on in your life. And as I said earlier, talking to individuals to say, do you have access to a primary care physician? If not, let me get you connected with our clinic, and then do you have access to a pharmacy? Let us get you connected to the pharmacy. So I think COVID allowed us to, again, as we've always done, think differently, react. And I always reflect on Dr. Valenti. One thing he says is like, let's think about what the need is. What's the community need? And let's respond to that. We'll work out how we fund it and how we resource it. That we're good at doing that. And that's what we did in the early days. And we will continue to do that into the future.
No need left unattended.
Exactly.
So, and the behavioral portion of it, I think, was an excellent to put into place because it's such a need within the community itself. So there are different ways that people can give back to nonprofit organizations. Let's talk about how people can give of their time and how and where people can volunteer for Trillium Health.
Yeah, so I think one of the biggest areas if you want to volunteer is food pantry. I think that's one. You don't need to be a medical provider. You don't need to know how a clinical setup works. Food pantry is a great place. I volunteer there when I get some time. My husband volunteers there sometimes, but that's a great opportunity to come in and volunteer. Also, when we're doing some of our events, one thing that we do is we help host Pride in the community. And Pride is a great opportunity. We're always looking for volunteers for manning the festival through to helping us with the parade. Always a great opportunity to volunteer.
Nice. So tax-deductible contributions can make a difference in people's lives. Tell us ways in which people can donate to Trillium other than just time.
Yeah, so as with any nonprofits, fundraising, connecting with donors is really critical for this organization. That's how we responded to the need in the early days, and we still have many donors that have been connected with us from the early days. But we have a number of ways. We first of all have our fundraising events. We hold 2 major events a year. We just held last week our World AIDS Day event. So every December we hold an event to remember those that we've lost to HIV, but also recognize that there's still a lot of work to ending the epidemic. So we do an event to fundraise there. And then every June, we have a white party. And Trillium is not your traditional fundraising organization in terms of having a sit down dinner, etc. We have a party.
Fun.
We have a white party, and it's around, we take over the Sibley building
Oh, wow.
and we convert that into a white space where we drape the place with white. We have everyone dresses in white, and we normally have about 650 people turn up.
How
So
fun. That's
we have drag
fabulous.
queens, we have a great DJ, we have drinks, we have food. But again, it's an opportunity to bring the community together, and that's our biggest fundraising events. Then we have other ways to give. We have our Founders Society, which is a way if you want to provide a large gift to the organization, you can be part of our Founders Society. So if you want to give a gift of over $10,000. Then we have our Friends of Trillium, which we want to encourage people to become ongoing donors. So if you give $1,000 or more a year, you can be a member of our Founders Society. And we do donor engagement events during the year to recognize our donors. But the money that is raised through the fundraising and through our donor engagement goes back into our care services. So we have a patient care fund, for example. That money goes into the patient care fund. So if somebody walks through the door and they need something, we have unrestricted dollars that we can use immediately to go back to that patient client. It's not there to fund overhead. It's there to provide those services. Recently, a couple of years ago, we launched our Adopt a Shelf program with our food pantry. So for, I think it's $1,200 a year, you can get your name on a plaque. But really what that does, for that $1,200 goes towards putting food on the shelves of our food pantry as well. And then we have our Legacy Giving Society. So if people want to recognize Trillium in their legacy giving, we have the capacity to set that up so that when people do pass away, we're recognizing somebody's will. So really important ways to bring money into the organization that's unrestricted, and people can really see that it goes back to our mission that we do every single day.
Recognize the kindness of all those people.
Yeah, most definitely. Oh, and we have amazing donors. They're a great bunch. And we just had, as I said, our World AIDS Day celebration last week. And this was a special one because this was one that we also recognized and honored Dr. Valenti for his 35 plus years at Trillium and founding Trillium, but also for his 53 years of being a physician in our community as well. So it was great to look out and see a room of I think we had 325 donors in the room that were there to recognize Trillium and to, of course, honor Dr. Valenti.
So how many people are involved in the Trillium Health organization in terms of keeping this fabulous machine moving forward with all of those community needs?
Yeah, so as an organization, first of all, we've really grown. If I look back of where we were back in 2018, 2017, 2018, we were serving around just over 3,000 patients and clients and patients. Today, we're serving over 14,500 patients. So with that, as an organization, we've really grown in terms of the number of employees. We're over 300 employees that work for Trillium. So it's amazing that we've been able to bring jobs into the community as we've grown within the community as well. We're going to continue to grow as we've got our new Jefferson Avenue location. We're looking to expand additional primary care at our Science Parkway location in the future. So as we add more locations, means we create more jobs for the community as well. So always plugging, if you want to come work for Trillium and you want a place where you are also treated with dignity and respect, come work for Trillium. Check out our webpage and look at the careers page and see what jobs we have. There's always great openings.
Fabulous family
Exactly.
concept. It's
Exactly.
not a case of thinking of it as just an organization that you work for. It's a family unit
It is.
that's providing all of that specialty care for the members of the community that really need it.
Yeah. And we have fun as well.
Right.
We
It is fun. It's not stuffy. It's
we
fun.
have great fun. And I always say that with employees, I know this is really hard work because it is hard work. But most people, everybody in our organization, because they're so connected to our mission, they love what they do. So that makes the work easier. But also we put in a bit of fun in there as well. So especially around the holidays, have a little bit of fun, enjoy the holidays, but also we invest in our people as well. One thing I'm really proud about is we invested in a well-being manager just for our employees. So she is there to focus on the mental health of our employees. So she will do individual coaching, counseling with our employees to help them through what's going on in their own lives. We have well-being rooms, so a place where if you want to just go meditate, you can just do that as well. So it's not just about providing care to our patients and clients. It's making sure that we look after ourselves, especially in today's environment where there's a lot going on. Everything outside of the doors comes with us as well. Mm-hmm. So we want to make sure that we get that balance. And we talk about work-life integration. That's really important. So making sure that we look after our staff, that's critical.
So keeping people centered.
Trying to do that.
And rewarding them at the same time with all of the good deeds that they're contributing.
Exactly.
So as we come to the end of our time together, it's fabulous information. Thank you so much for sharing all of that. And since we are recording during the holiday season, as President and CEO of Trillium Health, what is your New Year's wish for 2026?
My New Year's risk is we need to continue to be funded. That's so critical for us as an organization. We get the funding that we need to do this work, and I have an amazing team that continues to fight for that at all levels. The federal, at the state level, really critical. I want to make sure that we continue to do the work that we can do every single day. That we can have a team that is healthy, that can then provide that care. And that's all I wish for, is that's what it's about, is we are here and we stay in this community to provide that care.
Nice. So first, I want to thank you, Jason Barnecut-Kearns, and your wonderful staff for their help and hospitality today. If you'd like to find out more about Trillium Health, and was there anything that we didn't touch base on?
I think we covered a lot of stuff, but I think I always go to our website, trilliumhealth.org. That has all of our services on there. You can see how to give. So if you want to donate to the organization, there's a button on the top of the screen. Just press donate. But if you need access to services, we serve everyone. So it doesn't matter if you're a millionaire or you have nothing. We welcome everybody through our doors. So we want to be there for everybody listening to this podcast. It's like, and if you want to come to see who we are and learn about us, just come visit. Reach out to our development team, our fundraising team. They're always willing to share more. But as we said, come volunteer, come join us at Pride. Really critical. That show your support for our community. And I know we all are touched by different elements within the community. So that's what we want people to do, is just learn about us and then support us.
Come give a little bit of your time.
Exactly.
And be able to learn about all the good deeds that are happening that you may not necessarily know about.
Right.
Because you hadn't heard about it.
Exactly.
In regards to Trillium Health before. Yeah. So that's a great, thank you. That's a great invitation. And I think I'll put that off to many people. So if you'd like to check out more in regards to our show today, please go out and check out the show notes for more information on today's show. Thanks for joining us. This is the On the Go with the Glenn Advantage team, and I am your host, Marcia Glenn. Let the Glenn Advantage team be your advantage in the marketplace always. And search for On the Go with the Glenn Advantage team wherever you get your podcasts, and follow, like, and subscribe. for the series. And thank you so much for joining us today. And thank you, Jason,
Thank you
for
so
enlightening
much.
us all.
And thank you for coming to Trillium and seeing what we do every
My
single
pleasure.
day. Thank you.